Namaskar, you're watching the special edition of DD Dialogue. AFMS and the backbone of the armed forces response to the pandemic situation, wherein we are looking at more than 7,500 doctors. We're looking at more than 50,000 paramedical personnel from services doing everything possible to contain the current COVID-19 crisis. And this, in this edition of DD Dialogue, we're very glad and honored to have with us DG AFMS, Lieutenant General Anup Banerjee with us to tell us or perhaps give us an overview as far as this fight and the role of forces in this fight to contain COVID-19 is considered. Thank you very much, sir, for talking exclusively to Doordarshan. To begin with an overview of the service hospitals that are in place across the country, not only the states or the regions where we do have AFMS footprints, but otherwise also an overview of how AFMS is responding to the situation.
First and foremost, Namaste, a very good afternoon to all of you and the viewers, and it is a rare privilege for me to be heading or to be part of the family of about 75,000 medicals and paramedicals of the three services that we call tri-services of Army, Navy, Air Force, and to try to respond to the national call against COVID-19. By far not an easy call at all, but to the best of our efforts, reaching some sort of satisfaction. Yes, we have about 232 hospitals in all, including our field hospitals. But to tackle COVID-19, we had meetings chaired by the Honorable Cabinet Secretary, and we were tasked to establish COVID specific and mixed COVID hospitals where we could treat our own clientele, our service personnel, our ex-servicemen, their families, whom we call veterans, and civilian patients also. So we set about a list of 19 pure COVID hospitals and another 31 mixed COVID hospitals where we would treat COVID and non-COVID patients. And we kept a few criteria in mind. To be very specific, we ensured that there was some representation in each state of India, especially Northeast, where the backup facilities may be less from other agencies. So one criteria was we had at least one hospital in each state. Then these were very specific hospitals where we had a physician and an anesthetist, because these would be the main players against COVID and the known complications. And these hospitals would also have a basic structure, ideally in barracks which were separated or in floors and wards that were separated to prevent cross infection of other patients and healthcare workers. So there was a very scientific way in planning these hospitals, and it has given us the results that we expected.
So AFMS has contributed the entire hospital COVID care infrastructure across the country, and are we looking at this numbers, the number of COVID care hospitals to go up, dedicated COVID care hospitals?
Yes, the situation has become so variable, so volatile. So we are prepared to increase the number of hospitals depending on the hotspots that are coming up, depending on the unwanted and unexpected rise in the case that should come up. So that is our backup plan. We have plans to increase the number of facilities by all means.
And just for the clarity for our viewers to understand, now these are obviously anytime available to the civilian population as well. And are we also looking at some standby quarantine facilities plus the ones which already are there provided by AFMS body?
Yes, this is whatever decisions we've arrived at. This has been after multiple interactions and meetings we've had with the Ministry of Health and Family Welfare, with the ICMR, with the Honorable Defence Secretary Sir, Honorable Cabinet Secretary Sir. So these hospitals have been put on the national map, but we have been kept as not the first resort. Only when the facilities in civil are exhausted, or in place like Karwar, if I can give an example, where there were no facilities in any civil hospital. So the patients, civil patients directly came to our naval hospital at Karwar. But in other places we have been told that we are there as a backup plan. And also, let me also assure you, besides these facilities for civilian brethren, we also have a QRMT, a quick response medical team, which are sufficient in number along in the entire length and breadth of the country, which are prepared to go to hotspots in non-military stations.
And this will include your battlefield nursing assistants also?
Yes, let me also clarify. So, these will go to non-military stations. Should there be a hotspot in any state in the country, there is no army facility, these people, again in consultation with the Ministry of Health and Family Welfare, they will be picked up and they will be doing value addition to that station.
But this is on call basis, this is on need basis, sending QRTs and BFNAs?
QRMTs are already with us. It is up to the up to us to be given the call. And BFNAs, battlefield nursing assistants, are the men from non-AMC units, ideally infantry units, where they were earlier on taught first aid to treat patients in the battlefield. But it is so heartening that we have carried out training for these battlefield nursing assistants, and it is so heartening to see the glow in their eyes that they feel they are also contributing to the national cause.
Very nice.
They have also been told to be first responders should any COVID case or their emergencies arrive, and they will also be used as force multipliers should our strength of nursing assistants and other paramedicals fall short. So, this is again a picture of collaboration and cooperation that we are having, synergy that we are having within the armed forces.
You talked about collaboration, Lieutenant General Banerjee. What about alignment with DRDO, research organization, ICMR, and how is AFMS actually coordinating with other important stakeholders, for example, in the field of research to begin with?
Absolutely. It's again, it dates back to right from January when we had these meetings. The ICMR has been very considerate in helping us to train our pathologists and the lab assistants how to establish the viral testing labs. They have been very helpful, even the Ministry of Health and Family Welfare, to establish guidelines which we call advisories. So, we are working at a total symbiosis and synchrony. DRDO and all these labs have also promised us to give PPs and ventilators, whatever they are manufacturing. We are fortunately at a very top priority, but we also realize the national crunch. We also realize that we are part of the entire nation who has to look after these patients. So, they have already started giving us PPs and masks. They have the Ministry of Health and Family Welfare is giving us special oxygen cylinders, which we need to position in all our 50 COVID and COVID related hospitals should the requirement of oxygen set in.
Okay.
And about research, let me assure you that this is one of the pluses that we have gained, that the Armed Forces Medical College is carrying out roughly 50 research projects in the COVID-19 scenario, which will strengthen our insights, which will strengthen our response not only to COVID, but any similar disaster that is to.
So that's a very important point that you have raised. So,
and the various departments that are into this sort of a research in AFMC is the Department of Infectious Diseases, Department of Internal Medicine, Department of Critical Care, Department of Laboratory Sciences, and the Department of Community Medicine and Hospital Administration. So, these are various departments that have joined hands, and I have conveyed my personal gratitude to the AFMC, which is one of the units directly under the office of DGFMS, for their inspirational work that they are carrying out.
Okay, so you've raised a very pertinent point there, in fact flagged a very pertinent point, augmenting existing AFMC resources to deal with the current crisis, especially in the field of lab testing and resources. You've said that a lot is being done on the sidelines of research. Little bit more on those lines, because the entire nation is now waiting and wanting to know more about the vaccine development. So, if we not specifically touch the vaccine part, but the research part.
Well, as I said, the main problem is the dealing with the unknown and unseen enemy called coronavirus. Till now, not everything is known about the coronavirus. So, we are just seeing the response, the natural history, the complications, the pattern of problems that are being given to us by this coronavirus. And as far as the vaccine is concerned, we would like to be part of National Institute of Virology, which is a sister organization in Pune. Whatever we can, we will join hands with them. But as is a well-known fact, this is going to take months, if not a year. So, this is not a quick fix solution, but we would be part of any national program that we are asked to contribute, join hands in.
And also, you talked about how these challenges are also being used as opportunities. We are also looking at taking the consultation process to the next level, for example, teleconsultations. And is AFMC also trying to fine-tune other procedures in terms of meeting the current demands?
Yes, we have tried to convert our adversities into opportunities, and this is courtesy. We started our infrastructure development, and courtesy our Honorable Raksha Mantri ji, who was extremely magnanimous to give us emergency financial powers. We are building up our infrastructure of all, initially these COVID related hospitals. They are life saving equipment used to manage critical care, the number of ventilators, the number of monitors, defibrillators, oxygen concentrators, whatever equipment we require in the management of critical care, that has been beefed up now and beyond COVID. So that's a big plus point. We are much better prepared than what we were before January. The other pluses, if I can say, is it has given us inroads into telemedicine between tertiary care hospitals and so-called smaller hospitals. Teleconsultations, in which people are avoiding getting infected by COVID, and from home they are carrying out teleconsultations with the specialists and super specialists of the hospital without coming. Then our lab testing facilities have become far more robust.
That's important.
PCR testing, which was a very rare and uncommon known entity in the entire country, has come to the forefront. And this PCR testing is going to stay, is going to be beneficial beyond COVID. That's most important. We are not going to stop abruptly at COVID.
Yes.
So we have already established 10 facilities in the length and breadth of the country, and another 5 are going to come up. As I had mentioned, the ICMR has been very helpful in the initial part in funding, procuring, even getting our lab people trained. So we are extremely grateful to them. We are going to carry this diagnostics again. We have strengthened. The next is we have brought out management protocols in the office of DGFMS. We've had a meeting with the think tanks, and we've got the best people, and we have formalized training protocols so that any COVID patient walking into any hospital of the AFMS gets the same treatment protocol, and there is enough stocking of drugs required for this protocol.
So we're almost halfway through this special conversation with DGFMS. The entire robust apparatus of AFMS is in the battleground mode right now, and as and when the need arises, they will rise to the occasion. We are going to take, in fact, a very short break. When we'll come back, we'll talk about the AFMS outreach to SAARC countries and other neighboring friendly countries. Remember, the service doesn't stop here. It's gone much, much beyond the national boundaries as well. On the other side, stay with us. Thanks for staying with Doordarshan. You're watching special edition of DD Dialogue, an exclusive conversation with DGFMS. We've we were also talking about the whole outreach, AFMS outreach to SAARC countries, sending our QRTs to these SAARC countries. What all has been done on those lines, and what is the plan? Are we also looking at sending our teams to friendly neighboring countries, and in what capacities? Specifically AFMS's role.
The image of India as a superpower has again surfaced, and with the mandate given by our Honorable Prime Minister, we have sent a rapid response medical team to Maldives.
Okay.
This is basically to improve their infrastructure of communicable diseases, increase their capacity of lab testing, and this was very well appreciated. After which we had also sent a team to Kuwait on the same lines. And in both places their efforts have been extremely well appreciated, and it gives me a personal sense of achievement and relief. And thereafter we are prepared with the team. Should the call arise, we are there to send to other communities. Let me also bring out that our best practices that the AFMS is following in the treatment of COVID have been asked for by various international agencies, and they have been very well appreciated. So again, we have contributed in sharing our best practices.
Okay. And best practices with the neighboring countries?
Best practices in managing COVID have been asked for by various countries, and we have shared it.
Okay.
And which does not apply to AFMS, but what is known in the world over, the very fact we sent hydroxychloroquine to USA, and we've been sending other drugs to other countries, makes India a superpower.
Absolutely.
And one thing I would obviously have in my mind is that we are a country of infectious diseases, tropical diseases, like we have a school of tropical medicine dedicated. So I suppose there were reasons why we have dealt better with the COVID being infectious diseases. So we have had these viral infections down the line. So that's why we are placed the way we are.
AFMS has also been roped in to design these coaches in railways. If you could just tell us more about the AFMS's role and the way you're collaborating with Ministry of Railways, because now since we are in lockdown force, the situation is likely to continue for some more time.
No, we had just 2 very warm meetings with the concerned authorities, and they took our ideas as to the response should the beds in the civil static hospitals get exhausted. So we just sat with them and we discussed the designs of converting railway coaches to static coaches. So we stuck to our limitations as to just an advisory body, as to what all should be there, equipment wise, and then spacing, the emergency care, manning. So we gave whatever advice we could, and we were very happy to be part of the collaboration again.
And what about designing quarantine facilities? It all started with Narela and Manesar. They were also being looked at as model quarantine facilities. But now we're looking at lockdown 4, and there's a lot of uncertainty. There's no clarity per se what happens next in terms of extension of lockdown. In that sense of term, is AFMS on a standby mode, or the work is already under progress when we talk about augmenting quarantine resources?
Yes, initially we had single-digit quarantine camps in 6 stations. Again, the quarantine camps were also places that were linked to international airports. There has been a basis and a criteria of whatever has been done by us. So the first time, I think, in the history of the country was medical quarantine being organized, and we are very happy to say in a matter of just 48 hours, with the help of headquarters Delhi area, obviously under the service headquarters of the Indian Army, in a matter of 48 hours we could give a total overhaul to the existing condition at Manesar, and thereafter conduct an ideal quarantine camp. So much so we brought our residents from the Department of Community Medicine AFMC to take a look as to how to organize a quarantine camp. And the very fact that there was no so-called cross-infection within the camp, if I can use that term, the very fact that patients were isolated in various groups, barracks, the way we looked after their medical aspect, nutrition, recreation, mental status, the very fact we could position a team of 15 to stay within the camp, we are very happy with the outcome. And thereafter we have now double digit reserve quarantine camps kept should the need arise. And then the camp at Narela was different from the others because it was not in so-called a military area. So in a military cantonment, if I can say. So it is one what we call aid to civil. And besides the challenges faced at Narela, what I am personally very happy is that because of the soft skills of our medical team, they could bring such a transformation into the psyche of those in the camp that Narela camp has now become one of the biggest source of plasma donors.
That's very nice.
Those who were admitted there, they finally now adding to the treatment of other brethren. So it's something which has touched us, how our medical team has managed to motivate them, get across them and now they are so-called having a payback in contributing to the treatment of other brethren.
So, sir, National Crisis Management Committee and Crisis Management Group and internal organizations within AFMS, all these verticals we believe are at the disposal of the nation as and when the need arises to contain the current crisis. If you could just elaborate a bit more as to how AFMS is augmenting not only its resources but adding to more as far as the overall health infrastructure of the country is concerned.
Yes, we would like to be part of any national level organization, for example NDRA, NDMA, whatever is mandated by us by the Honorable Raksha Mantri ji in consultation with the 3 service chiefs. We would definitely be a force multiplier in carrying out whatever is assigned to us to the best of our abilities. And it is this challenge which has invigorated the roughly 75,000 team of AFMS members which you started off with.
Yes.
So we have always risen to the occasion. It is up to them to involve us in anything, whether to, as I said, give static care or move out in some sort of a QRMT care or to establish hospitals where there is not there. So it is a national call.
So the numbers are going to go up. Numbers of adding more COVID care hospitals or quarantine facilities, is it work under progress?
We are prepared for it. As I said, the number is so volatile, nothing can be predicted today, but we have to be flexible. We cannot be, the key word is flexibility, which we are taught from our younger days, how to, and we have got our field hospitals, if I can say, which are mobile per se. So we have field hospitals to augment our static hospitals. We have field hospitals that can be established in places where there is no such military so-called presence. So we have our backup plans.
And you are in touch with the states, basically coordination with the
Yes.
states in this regard is extremely necessary.
In whatever way can we have, because I am sure, as we are aware, the situation in Maharashtra is well known to everybody. So we, along with the service chiefs and the CDS, we are absolutely working together, and should the need arise, our facilities in the hospitals in Maharashtra will be given to our brethren. But we have certain, if we have certain shortcomings, that's also justifiable, but we are there. And as far as the aid to civil, it's again there with us.
Okay, so one final question, your message to the countrymen as far as AFMS's role in terms of containing the current COVID crisis is concerned. We are now already in lockdown 4 mode. What would you like to tell the nation in terms of armed forces first response to mitigate the impact?
Yes, I would like to say is that if at all the armed forces medical services have been successful enough to limit COVID, it is because of the discipline that they have, the awareness of healthcare that they have within them, that yes, they have to follow rules and regulations which have been laid down. It is also because of the monitoring which our officers and other ranks are doing, and it is also because of the healthcare advisories that we brought out, in which we have information, education and communication, the amount of posters, the number of lectures, the number of so-called videos that were brought out by the armed forces that have been very well circulated.
And you're still
yes, we are in the process. We are, as I said, we are ahead of the virus in many ways before the virus can hit us. So, all these things have been very well appreciated, obeyed and adhered to by the Armed Forces Medical Services, starting from hand hygiene.
That's a very strong statement, sir, that AFMS DG telling exclusively to Doordarshan that AFMS is much ahead of the virus in so many ways, that we are in the battle ready mode to contain the situation as and when it arises. The bottom line being, sir, that AFMS and its robust infrastructure is pretty much at the disposal of the nation and with the country and for the country to contain the current crisis. This is Armed Forces response, the way they are responding to the current pandemic COVID-19 situation. Thank you very much, Lieutenant General Anil Banerjee.
Let me also add by saying that this is another occasion where we are working at absolute synergy with the three services, the service chiefs, CDS, the Ministry of Defence, Raksha Mantri ji, DefSec sir. We are working at total unison. So
as
that's
one,
the best,
yes.
That's the best part of it.
Yes. On that note, that's the best part of it. We're working all as one, tri-services. Thank you so much, sir, for talking to DD News. And that's all we have for you in this exclusive edition of DD Dialogue. Thank you very much for staying with us. Namaskar.